We put a lot of stock in taking care of ourselves, hitting the gym, eating right.
Right.
But how often do we prioritize the things that literally keep us going?
Yeah.
Today, we're diving into the world of podiatry,
Oh,
taking a closer look at what matters to the specialists who care for our often overlooked feet.
it's about time we give those feet some airtime.
Right. And what better way than by dissecting the website of Dr. Thomas Bembynista, a podiatrist in Kansas? It's like a digital window into his philosophy of foot care. Now, one thing that struck me right off the bat is Dr. Bembynista's front and center promise of personalized care.
I see.
Not a generic welcome, but a statement of intent. What do you make of that?
It's fascinating, isn't it? More than just a trend. I think this speaks to a pretty profound shift in medicine, a recognition that our bodies are incredibly unique, and cookie-cutter solutions often fall short.
Right.
This is especially true for our feet, which bear the brunt of our individual habits, activities, and even our genetics.
So true. It makes you think twice about settling for a one-size-fits-all approach, even with something like foot care. And speaking of tailored approaches, I noticed Dr. Bembynista seems to be a champion of something called conservative treatment, especially for common issues like heel pain and plantar fasciitis.
Rightfully so.
What is that all about?
Well, by emphasizing conservative treatment, which means using non-surgical methods first, he's prioritizing what's often in the best interest of the patient.
Okay.
These treatments tend to be less invasive, allowing for faster recovery times.
Right.
And potentially fewer risks compared to surgery. It's about finding the most effective path back to happy feet while minimizing disruption to your life.
Makes sense. It's less about reaching for the scalpel and more about exploring all other avenues first. And frankly, as someone who's not a huge fan of needles, let alone surgery, that approach resonates with me. It shows a commitment to truly understanding the problem and exploring all options before jumping to more drastic measures.
Absolutely. And while conservative care is often the preferred route, there are times when a situation calls for more specialized intervention.
Right.
2 treatments on Dr. Bembynista's website particularly piqued my interest, probably because they sound like something straight out of a medical tech showcase.
Okay.
Laser treatment for nail fungus,
Yeah.
and something called fat pad restoration.
Okay, yes, those definitely caught my eye too. The laser treatment for nail fungus sounds pretty self-explanatory, but fat pad restoration, I'll admit I had to look that one up.
It's not exactly a household term, is it?
No.
But it's incredibly relevant, especially as we age. Essentially, the padding on our feet naturally thins out over time, which can lead to pain and discomfort.
Which makes walking, running, even just standing a lot less enjoyable.
Exactly. Fat pad restoration involves injecting a substance, often a gel-like filler, to replenish that padding and restore cushioning. It's like giving your feet a little extra support to cushion each step.
So less about aesthetics and more about restoring comfort and function.
Precisely. And it highlights a key aspect of Dr. Bembynista's approach, addressing not just the medical issue, but also the impact it has on a patient's quality of life. That focus on patient experience seems to be a recurring theme.
It's like he's saying, I see you, and I understand that this foot problem is affecting your life in these specific ways, and I'm here to help. And speaking of seeing patients, there's this line in his About Us section that really struck me. Don't be ashamed to show your feet. It's such a simple statement, yet so powerful.
It's incredibly disarming, isn't it?
Yeah.
So many people feel self-conscious about their feet, especially when there's something they're concerned about. By addressing that anxiety head-on, Dr. Bembynista is creating a more welcoming and judgment-free environment. He's acknowledging that it's okay to not have perfect feet, and that seeking help is a sign of strength, not something to be ashamed of.
It's a refreshing perspective, and it makes you wonder, how much does this emphasis on empathy and communication actually impact the effectiveness of treatment?
That's a great question. You know, there's a growing body of research that suggests a strong doctor-patient relationship can actually improve health outcomes.
Really? So it's not just about feeling good, it's about healing better too.
Exactly. When patients feel heard, understood, and respected, they're more likely to trust their doctor's recommendations, adhere to treatment plans, and communicate openly about any concerns.
Right.
That kind of collaborative approach can make a world of difference in any medical specialty, but especially one like podiatry, where people often feel embarrassed or hesitant to seek help.
That makes a lot of sense. It's about building a partnership, not just a doctor-patient transaction.
Precisely. And this commitment to a holistic approach is also evident in some of the more advanced treatments Dr. Bembynista offers. Remember we were talking about those intriguing procedures he highlighted?
Oh, yeah, the lapiplasty and the PRP injections, those definitely sparked my curiosity. What's the story with those?
Well, let's start with lapiplasty, which sounds like something out of a futuristic surgery suite.
Okay.
It's actually a minimally invasive procedure for bunions. Now, traditional bunion surgery often involves a longer recovery period because they have to make a larger incision and sometimes even break the bone to realign it.
Ouch. Not exactly what you want to hear when facing foot surgery.
Right, that's where lapiplasty comes in. It uses smaller incisions and specially designed instruments to shift the bone back into place without having to break it. It's about precision and minimizing impact, allowing for a quicker, less painful recovery.
So less trauma, faster healing. Got it. Now, about those PRP injections, my initial Googling told me it involves using a patient's own blood to promote healing.
You're on the right track. It stands for platelet-rich plasma therapy.
Okay.
They draw a small amount of your own blood, then spin it in a centrifuge to separate out the platelets, which are packed with these amazing things called growth factors.
Growth factors meaning they make things grow, like heal faster.
Exactly. Imagine these growth factors as tiny construction crews that rush to the injured area and start rebuilding damaged tissue. By injecting this platelet-rich plasma into a problem area, like a tendon or ligament in the foot, you're essentially amplifying your body's natural healing response.
That's fascinating. So it's like giving your body's own healing power a turbo boost.
Precisely. It's still a relatively new treatment option, and research is ongoing, but early results suggest it can be effective in reducing pain, inflammation, and speeding up recovery time for certain foot conditions.
It's incredible to see how far podiatry has come. We've gone from basic foot care to high-tech treatments and a deeper understanding of the mind-body connection in healing. It's like Dr. Bembynista is saying, your feet are important, your concerns are valid, and I'm here to offer you the most advanced, personalized care possible.
That's a great way to put it. And while all of this is incredibly impressive, it's important to remember that even the most beautifully designed website and the most glowing testimonials should be taken with a grain of salt.
You're absolutely right. It's easy to get swept up in the excitement of cutting-edge treatments and glowing patient testimonials, but those should only be part of the picture when evaluating a healthcare provider.
Exactly. Think of it like this. You wouldn't choose a restaurant based solely on a beautifully designed menu and a handful of rave reviews, would you?
Definitely not. I'd want to consider the overall dining experience, the chef's philosophy, the quality of ingredients, and maybe even sneak a peek at the kitchen if I could.
Precisely. Choosing a healthcare provider deserves the same level of consideration. Dr. Bembinista's website provides valuable insights into his approach, but it's essential to do your own research. Talk to others. And don't be afraid to trust your gut feeling.
It's about being an informed and empowered patient, not just blindly following the hype.
Absolutely. Ask questions, seek multiple opinions if needed, and don't be afraid to advocate for your own health and well-being.
Well said. You know, it's amazing how even something as seemingly simple as a podiatrist's website can spark such a thought-provoking conversation about healthcare choices and patient empowerment.
It speaks to the power of curiosity, doesn't it?
Yeah.
By taking a deep dive into this website, we've uncovered a wealth of information about podiatry, about patient care, and even about ourselves as healthcare consumers.
It's a good reminder that knowledge is power, and sometimes the most unexpected sources can lead us to profound insights.
And sometimes, all it takes is shifting our focus to those often overlooked parts of ourselves, like our feet, to gain a fresh perspective on our overall well-being.
So true. Well, on that note, I think it's time for me to show my own 2 feet a little love. Maybe a nice foot soak and a massage are in order.
I'll second that. Treat your feet, and they'll carry you far.
Words to live by. Until next time, keep those minds curious and those feet happy.